Now, as mentioned, September is Blood Cancer Awareness Month, and it is becoming increasingly more difficult to obtain prescription medications, particularly for those suffering with cancer. Here to talk to us today are experts around this matter, Dr. Rachel Rao and Abizer Gaslightwala. Thank you so much for joining us.
Thank you so much for having Abizer and me here today. Good morning.
So, Dr. Rao, tell us, how significant is the drug shortage problem here in the U.S.?
Yeah, this is a major problem and one that's been dramatically increasing just over the last few years. So for instance, in 2015, there were 5 newly announced drug shortages, and then that rapidly increased to over 30 in 2019, and even more, since the pandemic began. I think if you ask any cancer doctor in the country, they would say that they've had to make changes to their patient's therapy plan because of a drug shortage, be it delay treatment, skip a medicine, or change therapy in some other way. So it's having a direct impact on how we care for our patients.
It is just incredible that is something that we have to deal with here. Now, Abizer, can you explain why there are drug shortages and if this is a recurring problem?
Yes, unfortunately, they happen to a variety of reasons. Could be manufacturing difficulties, or even in particular, just variability in supply demand. What we even saw over the last couple of years, there was a shortage across the general healthcare industry, whether it was PPE, ventilators, or even in particular, even today, healthcare workers. What's important is we as an industry are critically focused on when we see a problem, how can we resolve it as soon as possible for the benefit of patients?
Now, Dr. Rao, tell us, how do drug shortages impact your treatment for patients, particularly those with leukemia and lymphoma?
Yeah, so it's having a very real impact on our ability to care for patients. As a pediatric oncologist, we've been very proud as a community to say that we're now able to cure the vast majority of children with leukemias and lymphomas. But those high rates of cure are contingent upon the patients completing the entirety of their planned therapy course, which is up to 2.5 years with many different anti-cancer medications. And families know this, so it's incredibly gut-wrenching to sit down with a family and say, we can't give your child this medicine we plan to simply because it's not available. And every parent's first question, it would be my first question as a parent, is, well, how does this impact my child's chance of being cured? And for a long time, we didn't really have a firm answer to that question. But very recently, a large study was conducted looking at thousands of children who had leukemia and lymphoma and were treated over the last few years. And that study showed that missing 1 or more doses of a single medicine in that long therapy plan increased the chances of a child's cancer coming back. So it's having a very sobering effect on our ability to cure our patients, and really highlights the need to come up with ways to prevent these drug shortages.
Now, Abizer, can you explain how companies and organizations are addressing the impact of this drug shortage problem?
Sure. We at Jazz Pharmaceuticals are always looking for innovative ways to bring our therapies to market quickly. In particular, we saw in this case where this critical medicine for treating blood cancer patients was in short supply, how can we find a way to bring this to market as soon as possible? So we not only worked within Jazz, but we also worked outside of Jazz with patient advocacy groups and external research organizations to find a way to work collaboratively to bring this therapy to market as soon as possible. And we're able to accelerate this therapy from 3 years to about 18 months because of this unique collaboration, so patients today can benefit from this life-saving medicine.
Wow, that is just so impressive to have accelerated the program there. So what key takeaways do you want our audience to remember as we are in this Blood Cancer Awareness Month?
Sure. So we always continue to be patient-centered. And when we saw that there was a disruption for this critical supply, it galvanized us within Jazz to find a way to work externally as well to bring this critical therapy. And we will continue to do so, not only as our company, but as an industry in general.
Well, we appreciate you both for joining us and just making us aware of what is happening here within the U.S. as we begin treatment for patients, and to just be an advocate for yourself. Now, we have a lot more here on Mountain Connections. We will be right back as soon as we come back after this break.